Today's topic is the social determinants of health and how to find data sets and such. I am Lisa Ennis. I am the library director and co-course director for Foundations of Modern Healthcare here at the Alabama College of Osteopathic Medicine. And I am also a Doctor of Public Health candidate at Samford University, and I will wrap that up this spring. So that's my exciting news for the day. So these are workshops that are put together by librarians at osteopathic medical schools, and they're just for fun and to help you advance your research skills, to support your scholarly activities, learn something new, just talk about things. It's for anyone is welcome, students, faculty, anybody. Participants after this session will be able to, they will know the main domains of the social determinants of health. They will know examples of social and physical determinants of health, and they'll be able to explain the social determinants of health effect on health. And we'll know where to find more information and data on the social determinants of health. And just by way of a little housekeeping detail, make sure that you are muted so that we don't have any extraneous noise going on in the background. Okay, so the first thing we got to do, right, is define social determinants of health. So when you do these kinds of things, you assume that the audience knows nothing or very little about the topic. So when we talk about the social determinants of health, what we're talking about are those conditions that people are born in, live in, learn in, work in, play in, worship in, and age in. And these things affect a wide range of health and functioning kind of things and quality of life outcomes and risks. And these are important definitions. They overlap social structures and economic systems that tend to be responsible for most of those health inequalities. And so we've got 5 domains here, and this is the official circle right here logo from the Healthy People 2030. And we're going to, if you don't know about Healthy People 2030, you will shortly. And so they divide the social determinants of health into 5 areas. We have education, access, and quality, economic stability, social and community context, the neighborhood and built environment. And this is one that's really interesting to me. And then healthcare access and quality. So this is what we talk about when we talk about the social determinants of health. It's the conditions in the environment where you were born, live, learn, work, play, worship, and age. So there you go. Okay, now this is a big public health thing. And most of the time now, when we talk about the social determinants of health, you will hear the phrase upstream, right? These are the upstream impacts. And so this ecological model right here, these are the upstream policy inputs. So policy like state and local federal policies and laws. So these could be policies that help you, like no smoking policies or laws, but laws that also can kind of, you know, aren't so helpful when you're trying to, you know, make your way in the world. So then we've got neighborhood and community. So these are social norms, but also resources. Do you have parks in your neighborhood? Do you have access to healthy foods? No, is there a farmer's market? Simple things like that that you don't necessarily have a whole lot of control over. So when you hear people talk about the socioeconomic or social determinants of health, you will hear upstream. And when they talk about upstream things, that's what they're talking about, this stuff over here. Because with these things in place, that can affect your individual choice. Maybe you don't have a choice because of these things right here. So upstream, policy inputs, neighborhood, community, physical, and social environments right there. All right, so here's Healthy People 2030. And what it does is it identifies public health priorities to, you know, just to improve the well-being of the United States population. It's in its 5th iteration, and it builds on the knowledge gained over the first 4 decades. And so for this decade, the 2030s, the social determinants of health are a priority area for Healthy People 2030. And so what this means is the federal government and all its entities recognize that these social determinants of health are very important when we're talking about wellness and long-term health. Okay. We also have now the American Hospital Association taking on the social determinants of health and looking at how hospitals can impact these sorts of issues. And they have 6 things listed out here: employment, health behaviors, food, violence. And if you click on those, and I'm going to show you an example. So I chose food. And so this, it tells you, what it is, it defines food insecurity and how food insecurity and health are related. And then this is interesting. This is, what is the role of hospitals in addressing food insecurity? So the AHA is really taking a hard look at what these social determinants of health, what they can do to help. And they actually have, if you go to their website, they actually have a curriculum, they have podcasts, they have videos, they have all sorts of resources for learning more about these things. I don't have an answer for that. Then we've got just a little graphic that kind of shows about food insecurity right here. So you got household income, employability, those sorts of things. And then of course, if you don't have a healthy diet, you've got chronic disease and those sorts of things. So that's just an example from the American Hospital Association of how they're trying to address food insecurity. Okay, so we've got this. Social factors, we talk about education and access to health a lot, but we also have these underlying and fundamental determinants of health and disease that includes ethnicity, family structure, living arrangements, social class, these sorts of things. And all of these things together create conditions or circumstances that either give rise to risk factors or alleviate risk factors, depending on which group you're in, right? So all of these things are going to affect how you deal with life and your wellness and your access to resources. So we've got some examples here of social determinants, just access to education, access to healthcare. We've got everything from social support, culture, residential segregation, socioeconomic conditions. We'll look at a couple of those. Do you have access to transportation? That's a big deal in rural health, right? It takes 2 hours to get to the hospital. That's an issue. If you have a car, or if you don't have a car, it's a serious issue. Exposure to crime and violence, those sorts of things. And just whether or not your neighborhood is even clean. Is there a lot of trash everywhere? Are the sidewalks walkable? Social norms, those sorts of things. All of these are examples of social determinants. Now, physical determinants are a little bit different, right? So these are your natural environments, such as green space. Do you have green space? There's a body of literature now that says, being around plants is good for you. It makes you feel good. The built environment, such as buildings, is it accessible? Are there bike lanes? Are the roads in good shape? Work sites. Do you have a safe work site? Does your employer make sure that safety is a priority? Same thing in schools. What does your school lunch look like? And what does the school playground look like? We've got housing and community design. This is a good one: exposure to toxic substances and other physical hazards. I got a slide that I think is going to shock you here in a little bit. Toxic exposures is kind of one of my things that I like to research and look at. And then physical barriers, especially for people with mobility challenges, right? If you've got a beat up sidewalk, how is somebody that has to use some sort of assistance going to get through that sidewalk? And if you're a new mother, pushing your baby on a broken sidewalk is difficult too. And so then just, aesthetic elements. Is there good lighting? Are there trees to provide shade? Because it's getting hotter and it's going to get hotter here as we move along with climate change. And benches, somewhere to sit down. We used to go places, with my grandmother all the time, and she had a bad knee. And if there were no benches, she had a harder time. All right, so we've got the 5 domains, and just look at kind of these in a broad way. I'm not going to read all this to you, of course, but we've got the economic stability domain, and that's, your financial resources, how much you make, what's your cost of living. 1 in 10 live in poverty in the US. 1 person in every 10 live in poverty. So if you just think about that for a minute, poverty, 1 in 10 people. The education domain, those with higher levels live longer, they're healthier. They just have more access to things, right? Better literacy, they can look things up. They have a better idea of how to, even you just read a prescription bottle. So education is a big one. Health and healthcare domain. About 1 in 10 people in the United States don't have health insurance. That's a serious issue. If you don't have health insurance, what do? Right? You don't go to the doctor early. You wait until you have to go. So then you're going to the ER. And when you get there, you're sicker than you would have been if you had a primary care physician that could catch things sooner. Then we've got our built environment again. We've got a lot of people living in neighborhoods. There's violence, there's graffiti, there's broken things, the air and water is unsafe. All of these things, nowhere to walk. You say, for cardiovascular health, you're supposed to get out and walk. Well, if your neighborhood is prone to violence and there's just broken glass everywhere, then you're not going to want to go out and walk in that environment. Social and community context domains. These are your relationships with family and friends. And so, that's what your kid, you say, well, don't hang out with the bad group. So this, it's not a bad group, but, your friends and coworkers and community members, whether or not you think about it, consciously, they affect your behaviors and they affect how things are. So civic participation, social cohesion, all of those things can impact your health if they're lacking. So let's just look at education. Education is the one that I tend to use as an example when I talk about the social determinants of health. So lower education is directly correlated with lower income. And then we've got children born to parents who did not complete high school or more likely to live in an environment that poses barriers to health. Right? Their neighborhoods are more likely to be unsafe, like we talked about earlier. And I love this graphic right here because it shows how educational attainment is tied to health, knowledge, literacy, and coping, right? So all of these things, if you have a lower level of education, you're more likely to be a smoker. So there's that. We've got educational attainment with work. If you have a higher level of education, your working conditions generally tend to be better. You're not exposed to hazards or, physical stress as much. Work-related resource, do you have sick leave? Do you have wellness programs? I mean, that's another big issue with COVID. It's like you come get the vaccine, but if you have to take time away from work and you're not paid for that time, it makes it very difficult to rationalize not getting paid to go get a vaccine that you may, with the mindset of, I may or may not need this or whatever. So taking the vaccine to where the people are, that's what you want to do. So sick leave, income there, and then, your beliefs and your social standing. All of these things are tied to educational attainment. So here's just some more examples. This one is stunning to me, that women with less than a high school education had 120% higher colorectal cancer mortality risk than those with a college degree, right? Because if you have a better job and you have health insurance and you have time to take, you have sick leave, then you're more likely to go for a screening, right? Because it's paid for, you don't have to lose money from not being at work, and those sorts of things. Adults with less than a high school education are almost twice as prevalent to have twice the prevalence of diabetes. And then there's your smoker one right here. So education has a huge impact on your health and well-being. And this is just an example, another little example, asthma. The prevalence of asthma is like in non-Hispanic Black children, they have a 2 times higher asthma prevalence than non-Hispanic white children. And then below the poverty line, you're 56% more likely to have asthma. Unsafe neighborhood, more asthma. And it varies by rate. Children in the South and the Northeast have a higher prevalence than those living in the Western region. Now, it will be interesting to see if that changes with the wildfire situation in the West. All right, so here we are with the US, right? The US tends to have more social inequalities in health than other industrialized countries. Okay, and the gap is particularly true for infant mortality and life expectancy, which is just amazing to me that this is a thing. So the US has a lot of catching up to do in terms of the social determinants of health and you know, equity and equality. So here we go. So now let's look at some data sources. So now that you have a sense of what the social determinants of health are and how they can impact health, where do you find more information? Okay. So the first thing I want to do is there was a question that came in earlier and it talked about dividing subjects up by race. And when you look at government surveys, they have a very strict way of doing this. And this is so that they have a standardized, we all know control vocabulary and what it does. So this is their control vocabulary for how to classify people. Now, is it perfect? We don't think so, but this is how they do this to be consistent. And so here are your categories and definitions. So you can get an idea of how they classify folks here. Right there. So 5 categories for data on race. There they are. And 2 categories for data on ethnicity. And so here's a 2-question format. You have race and then your ethnicity. And so that's how the federal government collects data on race and ethnicity. And so if you design something, you want to make sure you match that, or you're able to combine groups into those groups. And that's a whole statistics data thing that you can do, but that's beyond the scope right now. But since I got that question, I did want y'all to see how the federal government officially asks those questions when they collect their demographic data. And so now, of course, one of the best resources for data sources is healthy people. So you look at these domains and you look at the objectives, the things that Healthy People 2030 wants to accomplish, like lessening childhood asthma. Well, how did they get information on childhood asthma? Well, they're going to list out all their data sources for you. And one of them is BRFIS. This is a really neat survey, and you can go there to the CDC site and you can download the entire data set. And I like this one, the Behavioral Risk Factor Surveillance System. It's a telephone survey, and it's been in place since 1984. So there's a lot of data. And here's the Healthy People objectives that correlate or go with this data, which is pretty cool. So increase the number of states, territories, and DC that use standard module on sexual orientation and gender identity in the BRFIS. So it collects a ton of data, and it's a really good one for looking at things. And if you're a statistician, or you got a statistician friend, or you want to practice with a data set, this is an amazing data set to go in and look at and try to play with the data. But you can also use this data and publish on it. If you're a Red Hat user, the survey instrument, the BRFIS survey instrument, is in the Red Hat library. So you could actually have a group complete the BRFIS survey, and then you could compare it to the national, which would be very interesting. Then, of course, the CDC is going to have a whole mess of data resources on the social determinants of health right here off their site. And I do have these links at the end, so don't worry about that. So just to give you an idea, I just snipped off here the first few. Chronic disease indicators, chronic kidney disease surveillance system. All of these things are available online for you to take a look at, play with the data. A lot of them have interactive visualizations now, so you can go in and select things and it'll pop up a nice beautiful map for you. It's really nice. So that's one. This is another one, environmental health. When I did my MPH, my track was environmental and occupational health. So these are the things that kind of appeal to me. And I wanted to show, it calls it the one-stop shop for environmental and public health data. So you've got all of these, you got the asthma data, statistics and surveillance, all of these things, nutrition examination, hospital discharge. Then we come over here and we got biomonitoring data. And we've got environmental data with the air and ambient water data. I mean, just tons of stuff. And I just stopped. There's a whole list of things below this one that it just keeps going. And some of these will let you download the entire data set. Some of them you have to ask for the data set, and some of them you might have to dig a little deeper, but a lot of them are just freely available online, no problem. If you have Policy Map is a really, really neat. It has kind of an aggregator for data sets, and it will tell you, when you go in there and you do a search, it will tell you where the data comes from. And it's really, really neat. So here I highlighted the ones that kind of, go with the social determinants of health. And then I picked quality of life and environmental and disaster risk. And I picked Superfund. Now, for those of you that don't know, a Superfund site is the toxic place, right? There's something there that is so toxic that the EPA has to get involved and come help clean it up. CERCLA was a law signed by Jimmy Carter in the 70s in result of from the Love Canal disaster. So I searched this. Now check this out. All of these little thingies here are Superfund sites. So I promise you, I am not buying a house until I check this map. I want to know how close I am to a Superfund site. And so one of these is the Redstone Arsenal up here. We've got that one, landfills, all of these things where the ground is so toxic that it causes a health issue. And so what does this have to do with anything? Well, this comes into environmental justice, right? Because where do you think most of these Superfund sites are? Right? They're not in the best neighborhoods. So here we've got these things, and it tells you it comes from the EPA. So all of those are Superfund sites. This is another one I really like. It's the Public Health Tracking Network. Now you get frustrated because you see the gray for Alabama is not collected. So you do have gaps. Each state kind of has to do their own collection for some things. And if they just choose not to, then that's the way it is. But I did choose Georgia, so you could see that the percent is 12.8 for asthma. All right. So there's that one. This is really cool. It's really cool, and you can add to it. So I picked the prevalence of asthma from children 10 to 14. So that's 12% just for those 5 years. And this is a good one. This is the map inequality redlining in New Deal America, and it shows, all of the redlining that went on and is still going on in the world, which is an amazing map. But this has a lot of different things in it. It's a great resource to show students and for your own knowledge and edification of where these redline neighborhoods are. It's amazing. And then we have made a LibGuide on data sets. Basically, these are the ones that I like and ones that here, but there are others on this webpage too. So if you find something there that's good, let us know. If you find something that you think will enhance this LibGuide, let us know. This is part of a larger public health LibGuide that we did. And it's just basically a list of, was it too long to be useful list of data resources that we have students look at. That's pretty cool. And I want to point out, I got to give ACOM kudos here. We are a Healthy People 2030 champion. You can see the badge right there. And so you can still apply to be a champion to just show your dedication to wellness and helping with these objectives to make, the world a better place, sort of deal. So I'm pretty proud of this. There's a email if you want to apply. Right now we are the only place in Alabama that's a Healthy People 2030 champion. At least we're the only place in Alabama on their list. Of course, they could update it tomorrow, but right now that's pretty neat to me. All right. So that takes us to 1224. Some folks sent in these questions, and then we can take some other questions. So do you think that certain areas or providers would use these more than others? And I think the main thing is, they're putting the social determinants of health in EHRs, right? But knowing that information and then being able to do something about it is different. And so one of the projects we did is over the summer, a student did a survey at our rural health clinic and kind of got an idea of the main issues people were having. And then she made custom brochures for this area for those conditions. So one was food insecurity. Have you experienced food insecurity in the last ever how long? And if they checked yes, then when they left, they would get a pamphlet with all the local food banks and things like that. So how to sort by ethnic group or by geographic location. So that's going to depend on your statistical software and how the data was collected. So that's kind of one of those questions. This is a little too vague to answer specifically, but most of the data sets that I have messed with have at least let you definitely group by ever how you want. One of the issues sometimes you have is they don't get state. They might get census tract. And if you're looking at census tracts, then you're going to be crossing, all kinds of different boundaries, geographic boundaries that, don't make sense to regular people. They only make sense to census people. So it just depends on how the data is collected. So that's kind of my broad overview and kind of a place where you can go and kind of check out some of the data sets and some of the resources on the social determinants of health. And so if anybody has any questions, I am here. Okay. So yeah, so the slide, it will be posted. They're my references. It will be posted on the YouTube channel. So you can send them the YouTube channel. And then we've got the next one. Oh, thank you, Holly. I miss you. The feedback and what's next, please fill out the survey and let us know. If there are other topics like this you want, or any other topics you want. And then we've got the next one. Thank you. They got the next one coming up on the 12th at 1:30, and we got to register right there. And somebody wanted to see the slides. So that's a brief social determinants of health. I can give you all kinds of different resources for this. You just reach here. I'll put my email up there. That would have probably been a good thing to put on the slide, huh? But we do what we can. But email me. This is kind of my thing, especially environmental and occupational.